Well, good afternoon, all of my home care peeps. I'm so happy to be here today. My name is Merrily Orsini, and I am going to moderate and participate in this webcast that we are presenting today. First, let me do a little housekeeping. If you have not noticed yet, I have you all on mute mode. And what that means is that we can't hear you, but you can hear us. And if you have a question, on the right-hand side of your screen, there's a little box, and you ought to be able to type in your question, and hopefully we will see that prior to the end of our webinar and answer that question. So if we don't get to your question, we will answer it privately after this webinar. I am recording this webinar as well, so I want everyone to know that. We are going to get a question if we have not already gotten it. Let me just double check that I am recording. Good, I am. If we have not already gotten the question, we will get the question of, will we send you a copy of these slides? And we do not send out our slide deck. However, you will have the ability, when this webinar is over, because we are recording it, to watch it at your leisure or to send the information to anyone that you would like to watch it. So please feel free to do that on our corecubed.com/events page. We have a place for you to watch not only this webinar, but many, many webinars that we have recorded in the past. My name, as I said, is Merrily Orsini, and I've been in home care a very long time. And aging care is one of my passions, but also because I've been in home care a long time, I moved over into the marketing of home care after I sold my first agency that I had, first and only home care agency, and that was a long time ago. So I've now been in marketing and consulting to the industry longer than I was actually in home care itself. So I work with a fabulous group of people who are also experts in home care, and one of those who's with me today is our managing director, and actually she's a co-managing director, Amy Selle. Amy came to us working for one of our clients, and we were so impressed with her and so loved working with her that we enticed her to come work with us. So Amy, welcome today.
Hi, everyone.
Next, we have Marissa Snook. Marissa not only is co-managing director of CoreCube, but she also serves as our program administrator for our MOST program. And our MOST program, if you don't know about it, you should check it out because it really is a marketing program specific to the home care industry. And Marissa, you have so many talents, I wouldn't even begin to try to list them today. So let me just say welcome.
Well, thank you. Glad to be here.
Good, great. We're going to talk about inquiries today. We're going to talk about how you should best handle inquiries and what's the best way to change those inquiries into an in-home assessment and then into a client. So basically the important thing to know, and you need to look at your operations as I say this, is crucial to getting new clients is who answers that phone. So the person who does answer the phone, and we're going to talk about this a lot today, also has to know how to handle an inquiry. What's the best way to do it? And see that big smiley face on our woman here, our beautiful receptionist that we have here? She is doing what we like to say, which is smile into the phone as she's talking. So you know that person on the other end is actually feeling the love and feeling the warmth of that fabulous smile. You know, having an excellent service, matching the right caregiver with the right client, and having operational and service excellence is really crucial in today's competitive marketplace. And how you get to actually showcase that is by having that inquiry call be one of the most important touch points that you have and one of the most important aspects of sales. Now there's also follow up to that call and follow through, and we'll talk about that in a minute. But the key here is how you answer the phone, who answers the phone, and what they do with that caller when that caller does inquire about services. So at the end of this webinar, everyone on this call should be able to identify who is the best in your organization to have as your first line of defense. The person who is, it should be your first line of offense actually, because you are really offering up what you have to that particular client by that first phone call. Hopefully you will know and learn at the end of this, how are you going to ask the questions that are crucial to that inquiry call that best identify those client needs? And then what are some of the common objections, including price, and how can you best answer those? So let's start first with steps for success. Now these are really the basics, and we've had some conversations about what kind of person should best be the person who answers that phone. And Amy, you had some very interesting insight into the emotional intelligence component. Do you want to just talk about that before we go into the basics for success?
Sure. Excuse me. So let's just talk about the definition of what emotional intelligence is first. And it's defined as the capacity to be aware of, control, and express one's emotions and to handle relationships judiciously and empathetically. And so emotional intelligence really speaks to how you manage your emotions in relation to other people's emotions. And I think that's of particular importance in home care because when people are calling for service and asking questions, it's very common that they're experiencing some emotions that are going to come through in that initial inquiry. So you want to hire people who have good emotional intelligence and or if you have current staff in place who are taking inquiries, you want to be able to coach them on improving their emotional intelligence and doing the best that they can. And if you just do a quick Google search on emotional intelligence, there's a number of easy tools out there that you can use to help people both kind of gauge where they're at with emotional intelligence and learn how to improve that.
Thank you. You know, if you go and look to some of our past webinars, we do have a webinar on the psychological aspects of the person who is searching for home care, and I think that would be helpful for the person taking the inquiries to listen to and as well, because as Amy said, there's a lot going on when someone is making that call. But you know, these are the basics, and we're going to go into each of these specifically in just a minute. But I think the couple of things I'd like to touch on, this answering questions honestly and making it personal. Those two things are crucial here because, again, you've got highly charged emotions usually associated around seeking home care, and you do not want to overpromise and underdeliver. So if someone is unfamiliar with home care, and we have some of those questions later on in this presentation, but if they're unfamiliar with home care, they may ask questions that are difficult to answer or that you may think are not a positive towards your sales process. For instance, would be, can I get the same caregiver all the time? That is a question that oftentimes comes up because of some of the elder care horror stories where there's a revolving door on the caregivers that are coming in and out of the house. And hopefully your excellence in service provision will allow you to match appropriately. But it is a human-to-human service. So I mean, you're not producing widgets that can all, go out and guarantee it. People do have issues, and so you just have to be honest about answering people's questions. But that making it personal, the other thing about that, what I specifically mean there is write down the person's name. Write down who it is they're searching for care. Write down what types of issues there are that they are trying to overcome or why they're calling for care, and make it personal when you're speaking with them. So someone who's got a good emotional intelligence quotient will normally and naturally do those things, but for someone learning how to do it, you really do need to make it personal. So we'll touch on some of these other things as we go along in our presentation here. So when that inquirer calls you, you're going to get some of these questions usually. What do you charge? How can you help me? What services do you offer? And although those things are very important, it is almost impossible to answer those questions unless you have more information about the specific situation. So the appropriate thing to do is basically thank the person for calling, but say to them, before we answer your specific question, I need more information so I can be accurate in my response. And then you need to find out if they're actually calling about service in your location. And this is crucial because we see lots of websites that do not have contact information in service areas. So the most important thing is you want to make certain that you are talking to someone who is requesting service in your location. And oftentimes you'll have people call family members from out of town as well, so you can't tell by the number on your phone if they're actually calling about service in your location. So and this would be a good example of being helpful at all times, because if they are not calling about your location, hopefully you can refer them to a resource that would help them find an agency in their location. Home Care Association of America might be one, caring.com. So places where people can go and search for good agencies in alternate locations. Now this is the active listening component, or reflective listening, that you need to start with. Your job when you're taking an inquiry is to clarify their needs as much as you can clarify them. Now remember, these people really may not know what kind of services they're looking for. So if you say, what kind of services are you looking for, they may know some. They may know, well, my mother's not eating, therefore I need to have someone to prepare her food, but coach them into what information you need to know. Specifically, who is it that they're seeking assistance for? And then what are those reasons that they're calling you? Why do they need home care? And do they have a time frame in mind? I mean, is it immediate? Is mother coming out of the hospital today and I'm in Boston and she's in Baton Rouge, Louisiana, and I need somebody there today? Or what is their time frame? So also, when you're asking these questions and coaching them to get that necessary information, clarifying their needs and reflecting on what they have said to you to make certain that you're both on the same page in terms of what services they are looking for and how you can best provide those services, then this is really crucial in terms of establishing a rapport with them and establishing some trust in their responses.
I think the really most important word on these slides is to listen, because there's a lot of talking when people take inquiries on the behalf of the agency, because you want to explain your services, you want to explain everything all at once, and sometimes you got to step back from that first and let them talk to you and feed them questions so that they continue to give you the information that you need to respond appropriately.
Yeah, I think if you looked at the questions that we had in those thought bubbles, with the exception of the one about price, the other two are very broad, and in wanting to be helpful, your intake person may want to jump into well, we do this and we do this and we do that, and and then you're losing that opportunity to build a relationship and also personalize your communication with the person and your ability to gain the information you need to answer their questions. So we know people answer those questions because they want to be helpful, but we want them to as Merrily said, kind of coach the caller through a different sort of process.
Well, and the person on the phone who's answered the phone and has that inquiry needs to write down that question to know the most important thing they were looking for is what is the price or how can you help me. So you're going to come back to that, but what you're doing in the meantime is establishing trust, building rapport, finding out information to make certain that A, is it the right fit for you? Because, and this is where this comes in, clarifying the payment. Now, not that you are going to talk to them about price at this point, because you really want to do that as far along in the process as you possibly can, because you really do need to understand what they need before you can price it, but also clarifying for them, are they looking for home care for which they pay a fee? Do they think that Medicare is going to cover everything or someone else is going to pay for it? So, were they looking for some reimbursed care? Were they simply calling because they needed some information on decisions about care? And this may be their first call, and they may feel, based on what they saw on your website or heard about you, that you've helped others with decisions regarding care, and you may in fact have a care management component that could help them with that. Or what kinds of things are they looking for, and did they expect to pay for those things? So that will also help you in the beginning. If they say you are a private pay business and you do not provide any Medicaid services, or maybe they're looking for Medicare home health, you can really find out at this point early in the conversation before you go farther to make certain that they are looking for the kind of service that you provide. Then, if you are private pay, and I'm assuming most of the people on this call are, then you really do need to find out more in-depth information. And basically what you're looking for is, if they're coming out of the hospital, that's pretty clear why they need help, but why were they in the hospital? That'll give you an idea of what the duration of the care and the intensity of the care. But you want to find out if they have had care in the past, who was providing that care, or if they didn't have care in the past and they're thinking about getting care or know they need care now, what is it that caused that need to arise? I mean, was it a fall? Was it the death of a spouse? There's a myriad reasons why someone might need care. And that also, again, you're building this picture about the person needing care so that you are better able to respond to them about how you can help them or what the cost will be for that care. The other things you want to pay attention to, do they really need a medical service? And a lot of private pay agencies are what we call non-medical or non-clinical, and because of some of the state's licensure rules, you may or may not be able to provide some services. So, what kinds of things? I mean, I'm fond of telling a story where we had learned, I told you I had a home care agency for 17 years, and in that time period I did lots and lots of in-home assessments, in-hospital assessments. We learned early on in the provision of our home care business that 100% of the time we had to do a physical visit to do an assessment. And if possible, if someone was in the hospital, we also really needed to go to the home and see what the home is like too. So, but I did have a man that I met in the hospital. He was getting discharged, and he was eating lunch when I met him, and I made sure he got up and walked so I could see that, and I mean, did lots of other things in my assessment, and we got him home, and the caregiver called me and said, so what do we want to do about his tube feeding? And nowhere in any information, I didn't see it in the notes at the hospital, I didn't physically observe it when I was with him, and the doctor nor the discharge planner happened to mention that he did have tube feeding for some reason. I can't remember what that was, but anyway,
Wow.
it was...
Yeah, big thing to leave out.
It was. Now, fortunately, we had a good relationship with the VNA in our town, so we got VNA in there immediately, so we got that handled, and we did provide the service he needed, which was really, meals, and although he was eating meals because we were preparing meals, so I still don't know why he had a tube in his stomach. But anyway, so is what that person needs something you can provide, basically, is here. And then the location and hours and any specific needs that they might have. And that's when you're going to go into trying to find things. I mean, what about their food? I mean, are they okay with regular food, or do they have a kosher kitchen, or are they vegan? There's all different kinds, or gluten intolerant. I mean, lots of different things that could go on in home care. And then the other thing about transportation, someone's got to get to them on a regular basis, so you need to be able to do that. And then other times there are needs that the client may feel they have relating to their own transportation places that that you need to discuss ahead of time, or at least find out what it is they're looking for. Again, remember, a lot of people who've never done home care don't really have any idea on the limitations that the agency might have, either from legal standpoints, from risk standpoints, from from the standpoint of how you can licensure standpoints. So there's all different things that you are trying to find out. And again, if you're doing this in a conversational tone and really trying to figure out, is this a match, then that will come through to the person who's making that inquiry.
Ambulation, I think, is important too. I've had agencies who got to the home and didn't realize that the person used a lift, and they weren't prepared for that. So that's a good question as well to ask.
Well, I think that's great, Melissa. And I mean, Marissa, sorry. Whew. Only worked with me for 15 years now. That brings me right into cognitive impairment. That was the entree into listening for those clues, like mom's a little confused, and you get there, and hopefully you have in your repertoire of assessment tools some way to determine the cognitive impairment of the person. So there's the mini mental status test, which I understand is now copyrighted, but you can get those. They're not expensive, and it's a great test to to give to people in a conversational tone when you're doing the in-home assessment. So you can't actually find that when in the inquiry call, but you can when they say mom's a little confused. Say, well, does she know who you are? Does she know what day it is? Is she talking about the current president, or does she think FDR is president? So, some of those kinds of questions could actually help you determine how far along that digression into dementia that mom may actually be. Now, this gets into your agency's value adds. If you're a private duty agency, you have additions to your value that create a cost factor, and it is the understanding of these value additions to your services that cause them to be more cost effective, but also on the value side, you're trying to offer, if it's an adult child calling, peace of mind. You're really not trying to offer them a bargain because you really want to provide really good care. And if you are providing really good care, there are costs associated to that. So these are just some examples of things that your agency might have in place that you could talk about to them. And again, if you, when you're sending them follow-up information, follow-through information, if you send them a little checklist of what should you be comparing, because you want them to compare apples to apples, if you're doing all these things, if you're pre-screening, doing background checks, if you're monitoring and training and supervising, if you are covering your employees with liability insurance, professional liability, general liability, if you are bonded and insured, if you have a scheduling system that uses telephony or GPS as an electronic visit verification, so you know that that person is there when the shift is supposed to start. Those are all things that add cost to the care, but also add value to your clients. Because who wants someone to come in their mother's home to take care of them that hasn't been pre-screened, that hasn't been trained, that isn't bonded and insured? So these are all value additions.
And I think they're important to mention, especially in today's environment where you have a lot of services where that are cheaply priced, and people don't realize the liabilities involved. So pointing, if they are price shopping or looking around, pointing out these issues, it may be the first time they've even thought about that.
I just did a panel discussion at a local hospital in Louisville with an elder law attorney and a pharmacist. And the room was filled with people who had care needs and were in the process, thinking about how to hire people. And one of the things that came up, and it was wonderful to have the elder law attorney there because I mentioned the risks associated with hiring a private caregiver, and one of the big risks is if that caregiver injures himself or herself in the home, generally homeowners insurance isn't going to cover it. And I mean, there were audible gasps from the audience. And then the elder law attorney, of course, followed up and with that and about horror stories about, clients that she had had that ended up losing lots and lots of money because they ended up having to pay for injuries for someone who was a privately paid caregiver. And then there's lots of other risks and liabilities involved with that as well.
Yeah, I think that's a great point, Merrily. I have a friend who is searching for care for her father, and she does not work full-time, and her mother is still living, but they need intermittent support. So they were thinking maybe they would go with a private caregiver on the side, and wasn't as worried about the being bonded and insured. They felt like it was somebody they knew was credible. But the liability insurance and the potential for that person to become hurt and then seek to cover those expenses for themselves is really, the part that I think people don't realize, and they don't realize, how much those medical expenses can really add up to.
The workers' compensation coverage, I know some states it is not mandatory, but that again does help if you have some private person working in the home. The other thing is the billing, and if you can be flexible on your billing, so however they want to bill, to be billed, if you can be flexible in that, that will be helpful too. Now, let me give you a caution on monthly. I would suggest, if you are doing anything other than billing weekly or biweekly, that if you are going to bill monthly so you don't get into a cash flow issue, that you have them pay an estimated cost up front. So they start with a retainer, and then every month you work against that retainer and continue to keep that retainer in place so that you don't get into a cash flow problem. The other thing would be communication. Do you have a family portal? Do you have a way to involve the care team in the communication? So if you have that, this is something that was introduced a few years ago, but becoming more and more important as families are becoming more engaged in the care and realizing they can do it virtually as opposed to physically being there, and it does allow them some peace of mind additionally. But again, a cost associated, but a definite peace of mind component.
I've noticed also that some agencies are now offering a bill share option so that you know, family members are sharing paying for the bill, and the agency is making it easy and convenient for them to do that.
Yes.
Which I think is very attractive to families.
Yes, and a good agency software program should allow multiple billing resources. So so that is something. And I think the other thing, now that we're talking about payment, I don't think we have this in here, but being familiar with WAYS reimbursements. Now there's not that many for private pay, but veterans is definitely one, and a lot of people do not know about the aid and attendance program. They have no clue that, and they have dates. So if you are a spouse served in the military as an active military, active military personnel within date ranges while we were at war, then you are eligible for that aid and attendance program. So, so I mean, there are some things that just by really listening, you might be able to help them if they're worried about paying for the care. The other thing is clarifying your agency's differences. So we used to call scheduling, where you just put the warm body in the in the home, we used to call that fill in the blank scheduling, and there were a lot of agencies that did that, and probably there are some that still do that. But you know what makes for a long-term satisfied client is careful matching of caregiver and client. Again, your agency software program ought to be able to help you do that. And the other key here is sometimes the match may not be what you think, and this comes from really listening to what they say about their parents. What's important to the parent? Now this probably comes more so after you've got the in-home assessment, but if you've got a good history of consistency of staffing, that means you know how to match. And so that's really something that, if you're doing it well, is a great selling point. The other thing I would say, and this goes back to honesty, if you know in your head you have a perfect match, but that caregiver is not going to be available for another week or two, and the client wants to start services sooner, you can say, you know, Susie Jones would be so perfect for your mother, but unfortunately she's assigned on another case and she's not going to be free for 2 weeks. Now we have people that your mother's going to like, but and so, you know, she might find a good match, but this woman would be fabulous. So you can, you know, sometimes people will go ahead and allow you to put someone else in until you have that perfect match. The other thing is guaranteed staffing. Now, I have in here for 24-hour cases, if you can guarantee staffing for all of your cases, that would be wonderful. Some of the smaller cases, it's hard to guarantee staffing for. If you have a really bad weather or some situation where it's you know, impossible for the caregiver to get there. But if you have clients who are depending, or the key is they are going to depend on you to be that person caring for their loved one, and they are not physically there or can't get there and don't have any neighbors or support that can get there, then you can get a case by guaranteeing staffing, but you have to be able to guarantee it. So, but it's a great selling point. The other thing, and this is good for inquiries as well, is being open by phone 24 hours a day. If you can have someone answer the phone who is understands the business, can take an inquiry, and can also handle staffing and call-offs and all of those things that need to be handled, then that's another very positive selling point. And giving the call forwarding and the ability to access schedule systems on the cloud, it's just getting easier and easier all the time. So assuring them that you can do that and that someone will be there, a person that understands and knows and has access to information, that's a great selling point. So the next step here is getting an in-home assessment, because we all know that the highest percentage of turning inquiries into clients is when you actually get into the home to do that assessment. So up to this point, you are selling, basically. You're listening, you're reflecting, you're clarifying. But if that situation is appropriate for your agency, if you can possibly get them to wait on prices until you actually meet the person needing care, see the home, get a feel for it, then that's a wonderful time to give out prices, is once you do get in the home and make certain that that this is a client that you would like to have and one that you feel would work long term. So if you cannot get an in-home assessment, then you're going to have to go ahead and give them a price, but you're going to have to base it on information that you have received from talking with them on the phone. And this may vary depending on these indicators. Where are they? Is it really one person or two people who need care? What kind of care is needed, and what kind of hours are they talking about care? We had a client once who actually had a split shift, and one of the shifts was midnight to 4 a.m. Now that was a bear to staff. And the reason he wanted midnight to 4 a.m. is it was his two parents, and his mother was in a very late stage of Alzheimer's, and the father was the caregiver, and the father stayed up until midnight, but then they needed someone from midnight to 4 a.m., which was their idea of when this care was needed. So obviously, taking a case like that is a lot harder to staff. Can you imagine going to work at midnight and coming off at 4 a.m.? And then what do you do? So really basing the price on what the client is specifically requesting. Now, one of the other things you ought to talk about is any call can be an inquiry. I strongly suggest that you use different phone numbers for different things within your office. The published number of your business is where people are going to call. So the number you have on your website, the number you have on any of your marketing materials, your main office number, that's where people are going to call. If you triage those calls through different phone numbers, then you can tell when the call comes in which one has the potential to be an inquiry. For instance, if you have a separate number for all of your ads and all of your information for recruitment, then you know if you're on an inquiry call and you get a recruitment call or someone who wants to make an application, not that caregivers are not important, but that inquiry call is more important at that moment. So if you use a different number, then you'll know that, and then when that one inquiry main number is and give that to your clients as well, so that you'll know it's going to be a client or an inquiry when that call comes in. But any one of them can be an inquiry. So what does that mean? It means that whenever that phone rings and it's a potential inquiry, clear your mind, clear your desk, get focused on what that person is saying, and get serious about engaging with them and talking to them about what's going on in their life that makes them need care. If it's lunchtime, if you're having an all-staff meeting, if there's not anyone available to take that call that knows about services, just, that again, we're all humans, and it's a relationship business. So get the phone number and have someone call them back. And you can say, do you know, I would love to talk to you about this, but I really think that our social worker or our nurse or our administrator or our field manager, whatever, is going to want to talk to you, because they can give you so much information that's helpful. And then get their number and call them back as soon as
Yeah,
possible.
I think it's important to mention here too that it's really important to have a person answering the phone. We still do encounter a number of agencies that have an auto attendant, and you know, it delays their ability to get the questions answered that they need to get answered, and I think it increases the chance that they're just going to hang up and move on to the next agency on the list.
Yes.
Would you agree with that?
Yes. Yes. You know, the other thing, and we are not talking today about how do you get that phone to ring. We do have, Marissa or Amy, do you have specific names of webinars that someone can access on our CoreCube.com events page for getting the phone to ring? I know content marketing is one of them that works.
Yes, if you can go, if you're interested in answers to that question, you can go to corecubed.com/events, scroll to the bottom of the page, and it says right there, watch past webinars, and just click that link, and you will see all of our past webinars listed. There's some wonderful ones on how to get that phone to ring and how to get people to fill out your web inquiry forms.
And I will say that, you know, we have an hour today to talk about inquiry specifically, but getting that phone to ring is crucial, and marketing is changing. How people get their information is changing. And so much of it now is online, whether they're looking at reviews, whether they're looking at your website, whether they're getting information on social media, but a whole lot of it is online. But I will tell you, what we do know is 95% of those people who are out finding out information, you know, in all different kinds of ways at all different hours of the day, they're going to call you, because they're going to narrow this down to a list of potential home care agencies. And if your website is mobile enabled and your phone allows someone, when they're looking at it, to push the button and call, you're going to have a much better chance of getting that call in the first place. But we do know that 95% of them are going to call you. The other thing, I had an interesting call the other day with caring.com, and we were talking about the people who are contacting them for you know, recommendations for home care. And what they said was, the specific example was, the physician had said, please call, you know, ABC Home Care, ABC agency, because I think they do a good job. But before that person actually called the agency, they went to, in this case, caring.com. There's other places to go for reviews. I mean, they could just Google ABC agency and then see where are the reviews and go look at those. But in this case, they had gone to caring.com and they call the agency. Well, caring.com has a specific number, so they knew that the person had called based on that number that went directly to the agency. But when the agency asked the caller where they heard about them, they said, my doctor. So but it was proven that they had actually gone online to look at reviews and to check out that agency before they called. So I just don't want to skip over the importance of how people are getting this information now. And
the statistics show that there is a lot of online research before they pick up that call. So if they have done some of that research beforehand and they call your agency, you got to treat that like a gold mine. And you can't have a receptionist ruin it for you by answering in a really rushed manner or frustrated manner to destroy the tone of that experience for the caller.
So hopefully you're getting the picture here that it is crucial to have somebody answer that phone that knows what they're doing. And the other thing is using an inquiry tracking form. So I'm not saying read from this form. I'm just saying all these things we're talking about you need to have so that you can make notes, because it's not only going to help you make a decision of is this the right one for you and is this someone you want to pursue, but it's also going to help you get specific personal information so that you can follow up with that person appropriately and make certain that you are answering their questions and that you're continuing to sell to them and get in front of them so that even if they don't choose you the first time, they may come back if they have a bad experience. And if they're price shopping and they realize what happens when they do price shop, then like as not, they're going to come back to you. So that follow-up is going to be crucial. But we've talked about some of these questions. So, I mean, it's really in your inquiry tracking form, you should have all of these things we've talked about and make certain that you are gathering this information from them and gathering it once so that you don't have to ask them that same information again. And then from a marketing standpoint, you really want to know what was it that made them call your agency. If you're getting referrals from some specific person repeatedly, you better be writing personal thank you notes to that person. If they're calling your agency because of something, an ad they saw or your website, then you want to know that as well, because you want to continue to have that be something that's going to entice people to give you a call. And then also how they heard about you. Maybe they heard about you from the doctor, but the reason they called was they saw a review from one of your past clients, or they heard about you from the pharmacist, but one of your current clients actually recommended you, and that was a friend of theirs. They go to the same hairdresser or something. So these are all things you need to have on an inquiry form so that you have enough information to be able to get some data together so you can make good marketing decisions in the future. This is just sort of a wrap up. We've talked about honesty and making it personal, and the fact that you really do want to sell on value. If someone is price shopping and you're not the cheapest, you are not going to win that client. So you really do need to learn to sell on value. And that reflective listening, as Amy said, having someone who really has a good emotional intelligence quotient so that they can listen reflectively and clarify and be empathetic and understand that psychology behind the behavior that the person is that's giving you a call. This contact information on the inquirer and the potential client. So if you don't get that in-home assessment, or you basically are not moving forward after that first call, it'll allow you a wonderful way to follow up. I would suggest strongly personal letter or email, and I would ask the person you're talking to how best they would prefer you to communicate with them. You can send them a price sheet with service descriptions on it and make sure those value addeds are on there as well. If you make it personal, information that is specific to the caller, so if they're interested in something to do with dementia care, you are sending that information. So I mean, basically making follow-up fit to the situation and the person so that they know they're not just another call, they're a person to you, to your agency.
Yeah. And we still run in, when we do some mystery shopping, we run into agencies that we call, and then there's no follow-up email afterward. And it's kind of shocking to us, because I think it is one of the most polite and helpful things that you can do is to follow up with an email to say, I appreciated speaking with you. If there's anything else I can do for you, please let me know. Here's some information attached that I think would be helpful in your situation. I think we we all would like that kind of service. So when we don't see agencies doing that, it's very surprising. It really makes a big impact on the people that are inquiring and engaging with your agency. Follow-up is really important.
And follow through. Do what you say you're going to do. And again, as Amy said, it is amazing to us how people do not follow through. Even when they said they were going to send you something, they don't. So if you are just doing a really good job of making it personal and have systems in place that allow you to do the follow-up, then you can oftentimes pick up new business because other people are not doing such a good job. Now, the other thing that I suggest is that you have an inquiry form at every desk. And even if you have an online system, to have something there that, heaven forbid, an internet is down or it's being slow or whatever, you need to be able to respond immediately and not be typing things in the computer. So if you can have this information where you can literally use it as a guide, and then go back to the listing that I talked about in the sequence that I'm suggesting it, and if you need to make a referral early on, say you're a private pay business and someone really is in the hospital, has the potential to be a Medicare certified patient, then you can make a referral immediately. And if you can give someone a number to call or send them an email with information on it or send them a link to resources that are appropriate for them, you will be making a friend for life. So the other thing is frequently call numbers. So again, anything you can do that's helpful that you can put in that inquiry book. And then that price sheet with service descriptions. If you have to give prices, you can give a range. And you can, after you've gone through as much as you can, you don't want to aggravate the caller. So if you have to give prices, but give a range, don't give a specific. And say, again, based on the in-home assessment, it would be this price range. But at every single desk in your office and with the on-call staff or whoever's answering that phone, they need to all have that same inquiry book that gets updated regularly. So it's not that much work to do, and it will pay off in spades. Let's just talk a minute about overcoming objections. I think the expense is one. So if someone says, oh, that's too expensive, they may not be comparing apples to apples. So again, we talked about the different components of the value adds. The other thing is minimum hours of service. I think people who don't understand home care don't realize that physically getting a qualified caring person to that destination is the hardest part. So if they want 4 hours of service or less, you really have to be creative about ways you can do it. And the key is finding the person who, again, that caring, qualified person to go to the job. So someone who may not want to go to a 4-hour job might take a 2-hour job if it's priced correctly and if you're paying them correctly. So there's ways to handle that, to get the caregivers to go do something they may not want to do. And usually people who start that 4-hour service or 2-hour service, after a while they do tend to need more. They're either going to need nothing or they're going to need more. That individualized care plan, trying to get that in-home assessment, it's really crucial. I mean, as Marissa said, one of the things, actually watching someone ambulate is critical, because being able to get up and down out of the bed and a chair to go to the bathroom is crucial in terms of being able to stay by yourself at night. So you really do have to make certain someone's got that capacity. And then you've also got the opportunity to give them some clues about safety. So, it's getting that in-home assessment. You can overcome some of those objections. That stranger in my home objection, over time, the caregiver, if you're matching correctly, is going to become a trusted companion to that person. And, you can always say, like any relationship, what does it start with? An introduction. So if someone is uncomfortable with that, you can always meet the caregiver there and make that introduction. We're still hearing of agencies where people are placing discriminatory requests, and my advice is simply don't do that. No matter how badly you want the job, if you, A, it's illegal, but B, if you use some form of racial whatever to staff, you're going to get into trouble because you're not going to be able to guarantee staffing, and your staff is going to not trust you because they're going to know that you're discriminating. So I would recommend against that completely. Here's just some frequently asked questions. And I'm going to go through these, but definitely know the answers to these because, and if you need to train your staff on what the answers to these things are, then make certain that they know that too.
And they can have a little sheet next to their phones with the answers so they can quickly access those answers.
Yeah, this should go in your inquiry form and your resource book so that people that don't know the answers to these, they will learn them over time, but you have to have them in that resource, and you do not want to be saying to the client, gosh, I don't know the answer to that question. The biggest one, I think, is everyone assumes that Medicare is going to cover everything. It's always a shock to them when it doesn't.
This may be a good spot to mention that some of these forms we've been mentioning we have for sale on our markethomecare.com website. So if you want to buy that telephone inquiry form, for example, we have that you can buy as a separate form on Market Home Care. But I would also highly recommend our marketing manual that's for sale on Market Home Care. It has not only that telephone inquiry form, but letters in response to inquiries, follow-up letters, all sorts of wonderful information that you can use when you get that inquiry call.
Yeah, and I've put some of the links to those products up in the chat box for you.
Thank you, Amy, for doing that. I'm going to also move into our contact information because the link to the past webinars is corecubed.com/events, and it's in the main navigation, so you can find it fairly easily. We also have someone asking if we can do a secret shopping program for private pay. Yes, we do that often, and we're very good at it. So I feel guilty sometimes because someone thinks they're getting an inquiry, but it really is great. And if you don't do mystery shopping for your own agency, you really ought to try that. It is usually an eye-opener, particularly the follow-up component. But occasionally we'll find people who do a wonderful job. We have products about inquiries on our Market Home Care website. So we do have inquiry tracking sheets and some other things on that, plus the manuals, as Marissa mentioned. So that is the end of our questions, I think. Do we have any more? Let me double check. You all have been a wonderful audience today. Again, Amy's put the links in, corecubed.com/events. Someone's asking for the link again. And thank you, Marissa, and thank you, Amy. And thank you, audience, for being really good today. You've stayed with us the whole time. And if you have any further questions, please don't hesitate to call us. We'd be glad to talk to you. We'd be glad to provide services for you. And I can honestly say I firmly believe we are the best solution for your home care marketing needs. Thank you so much, and everyone have a wonderful day.